Each legislative session, KHI is hard at work keeping you informed on the latest health policy discussions from across the street in downtown Topeka. Health at the Capitol is a KHI production, a monthly recap with our legislative monitoring team offering you a closer look at policy work happening now in Kansas and coming up. Here's a look at topics from our latest episode. Thanks for joining us for Health at the Capitol. This is a monthly recap of legislative activity, and we're taking a look back at the last 30 days, but also this is an opportunity for us to look ahead at what's coming up. My name is Teresa Freed. I'm the Director of Strategic Communication and Engagement with the Kansas Health Institute, and I'm joined by Linda Shepard, who is our strategy team leader. She oversees our legislative monitoring team, and we also have Carrie Bruffett, who is the President and CEO of KHI. Thank you both for joining us.
Thank you, Teresa.
Thanks, Teresa.
All right, so let's start off by just talking about kind of what we're in right now. This is known as turnaround time. So can you explain exactly what that is?
Right. So turnaround day was last Friday. And really what that means is that any bills that are going to be active and continue to move forward throughout the rest of the session had to get through their chamber of origin. So they were had a hearing in their in the committee where they were introduced, made it to the full chamber, and then passed on out and ready to go to the other side now. So that's the way most of the bills get through, but there are some exceptions to that for bills that were originally introduced in what is referred to as exempt committees, and there are a number of exempt committees, appropriations, for example. Those bills, even if they didn't get through that first process, are still active and can continue to be considered during this second part of the session. Also, there are some bills that occasionally will get moved to one of those exempt committees temporarily, sometimes as short as a day, and then get moved back. And so that's considered to be blessed. And those bills can also continue to move forward going into the next part of the session.
All right. So a very important time for us to take a look back, but also, again, looking at what's coming up. And so our particular focus at KHI is on health policy. And so there's been a lot of activity recently related to health policy discussions. And one of those is about public health authority. That's a more recent discussion. Can you talk a little bit about what's happening with that?
Yeah, so there are a couple of bills that are still active now that got past the first chamber, Senate bill. So there's Senate Bill 390, which is the Conscientious Right to Refuse Act. And this bill would prohibit employers, schools, medical facilities to take any sort of action against an individual who is refusing to be vaccinated, or to take any sort of action related to some disease that they would are opposed to, have a belief in opposition to. And the bill does include some definitions of what it is that the person would indicate as far as their opposition to that. But again, the main thing is that the action could not be taken because they refused to take those. Included in that bill also is a repeal of a number of statutes that give KDHE authority to take certain kinds of action related to isolating or quarantining individuals with contagious or infectious diseases. So there's about 3 or 4 existing statutes that would be repealed and removing that authority away from KDHE. Another bill is Senate Bill 391. So that first bill was 390. This one is 391. This bill is very specific to, it's called the Constitutional Right to Health Freedom Act, and really does limit KDHE's authority with regard to how they deal with infectious and contagious diseases. Again, removing a lot of the authority that they have to dictate how people should respond in those kinds of situations. The bill does allow them to continue to make recommendations. So if we were to have another COVID-19 pandemic, they could certainly make recommendations about how they think those things should be handled. But their ability to have any enforcement or take any action, if those actions are not undertaken, would be limited or would not exist.
So, Linda, I would add that while that bill did pass the Kansas Senate, you noted, and I think our Health at the Capitol updates note that there's significant opposition as well from folks in the public health community and others who presented information at the hearing about that legislation, as well as proponents who also presented testimony at that as well. So interesting to see what will happen when it goes over to the House and how that debate continues, and would anticipate that folks will still want to have their voices heard in that debate on the House side as well.
Yes, thank you.
Okay, and also central to KDHE is the discussion about Medicaid. I know it's kind of gone up and down in different ways, and we're certainly focused on the discussion because we've recently produced some work associated with that, some data to help inform some of those discussions. So, Carrie, do you want to talk a little bit about what's happening with that?
Sure. So in the first part of the session, we heard that both on the House and Senate side, we expect there would be committees that would be discussing Medicaid expansion. That hasn't happened yet, but that still can happen in the next part of this session as well. There have been the only real action related to Medicaid expansion in the legislature in the first part of the session, and Linda, you can correct me if I'm wrong, is really just through the budget process. So this House Social Services Budget Committee, for example, removed the funding and the revenues associated with expansion from the KDHE, the Department of Health and Environment budget. But that's not an unusual action for them to take. That's something that typically has happened in the last few years with the legislature in response to the governor's proposals to expand Medicaid. But we expect there'll be an opportunity for the legislation, which Linda reminded me was introduced in exempt committees, so that can be discussed later on in the session as well. So look forward to what that might look like, and in both the House and the Senate.
Okay, and do you want to talk a little bit about some of the work that we've done on this?
Sure.
topic?
So KHI has for many years produced estimates of Medicaid expansion, enrollment and costs and new revenues and savings and offsets and that sort of thing. We also took a closer look this year at the population, the characteristics of the population who would be likely to to enroll in Medicaid if expanded. In particular, because the proposal to expand Medicaid that's in legislation this year includes a work or community engagement requirement. And so we looked at the percentage of potential enrollees who already are working, or if they're not working, what are some of the characteristics they might have that could qualify them for exemptions in the legislation. So we're hopeful that data and information can be helpful to the discussion for policymakers in this next part of the session.
All right, so we'll definitely have to wait and see on that. Another big topic of importance and one that we're focused on as well is behavioral health. But there are several different initiatives that have been discussed recently. So would you both like to touch on those a little bit?
Yeah, on the behavioral health side, one of the things that I think, this was done early on in the session, for a number of years now, there has been this mental health intervention team program that's been operating in the state. And this involves various programs that go into schools. School districts can sign up to participate in this program. And it really makes it much easier for the schools to help identify young students who may be in need of behavioral health services, and then making it much easier for them and their families to access those services in the schools. And for several years now, that program has received funding from the state, but it's always been put in as a proviso into the budget. It hasn't been, it's not something that's been sitting there. So this year they did move it into, actually introduced a bill. And so that bill is moving forward, and it codifies that program now. So they won't have to do it sort of year from year to year with the proviso. So that's really been done. One of the other things that's interesting was so there has been this, and Carrie, you're going to have to help me because I always forget how, the certified community
behavioral health
centers. Yes, I always get
CCBHCs.
CCBHCs. That ability to designate community mental health centers as CCBHCs has been in place for some time, and there is a bill right now that is clarifying some of who can be eligible to participate in that in that program. And it's being made very specific to community mental health centers. The way the bill was worded before, it appeared that there might be some other types of facilities that would be able to participate in that program, but it's pretty specific to community mental health centers at this point.
And that's not without controversy, because there are other providers and provider types that have expressed interest in being able to provide services and really provide the spectrum of services under the CCBHC designation. So it'll be interesting to see where that goes moving forward.
Yes, there was the hearing for that bill. There was a lot of lively discussion, definitely some opponents to that bill. So I'm sure that will continue on the other side.
Right. You'll be watching, I'm sure.
Yes, we will.
All right. Moving on to our next topic. And it's one that we touched on during our initial episode here. And that was about homelessness and some of the measures or proposals associated with that. So, Linda, if you want to share kind of the latest on that.
Yeah, so I mentioned last time we met that the Committee on Welfare Reform, this is a House committee, has been spending quite a bit of time looking at the whole issue of homelessness. So there have been a number of informational hearings that have occurred. They've brought in some outside speakers who have been dealing with homelessness in other states, other communities, and having them share with them some of the solutions and the things that they've done to try to address that problem in their own locations. And Chair Auerkamp has indicated that this is something that he continues to be interested in and will continue to hold hearings on this topic going through the rest of the session. And there has not been a bill specific to this, but in the budget for KDADS, there was money that was placed in there by the governor to provide money to communities who are trying to deal with this problem and give them a chance to use those dollars for whatever sorts of housing opportunities that they might come up with to deal with the homeless in their communities. And that was $40 million. And that $40 million was removed from KDAD's budget, and so is currently not available, or at least not being considered right now. However, the budget, the part of the budget for KDAD's has actually been sent back to the Welfare Reform Committee for some additional consideration and discussion. So that's one of the things that a little bit unusual this year, but they were giving some of the committees who are very specific in a certain topic an opportunity to weigh in on some of these budget decisions. So that conversation will continue.
All right. Very interesting there. And then also related to KDADS, talking about intellectual and developmental disability, the waiver services there. So, Carrie, do you want to share a little bit about kind of the status of the discussion on that?
Yeah, certainly. They're both in the governor's budget and the social services budget committee and the governor's budget amendment as well to add funds to add additional positions or slots for both the home and community-based services waiver for people with intellectual or developmental disabilities, as well as those with physical disabilities. So there is funding. It's a priority that both the governor and the legislature are addressing. It's interesting. This year as well, there's been some discussion of sort of setting a maximum of what the waiting lists can be for both of those waivers, and then requiring each year's budget development to make sure that the budgets proposed for those waivers ensure that the waiting lists don't exceed those numbers. So it'll be interesting to see how that proceeds. I don't think that's proposed as like a permanent waiting list, for example, but it is sort of to minimize or not minimize, but limit the size of the waiting list and limit some of the growth of the waiting list that folks have been watching and concerned about.
Okay. And again, another one it seems this topic comes up every session. There's always, some discussion about how to address it, but it seems to be an ongoing issue that will continue to be ever present, it seems.
Yes, absolutely. It's a priority for the governor's office, for members of the legislature, to be able to address the waiting list. They have people that have been waiting in some cases more than a decade for services. And as an issue, it's been around for more than a decade as well. And certainly There's advocates and others who point back to some of the promises at the beginning of the CanCare program to really commit to reducing the size of the waiting lists. So it'll be interesting to see not only how that progresses this year, but how that's maintained moving forward.
And another area of focus for the Kansas legislature has been reproductive health. A number of different measures proposed during session. And so, Linda, do you want to tell us a little bit about one that's getting a lot of attention?
Yeah, one bill that is getting a lot of attention, it would be House Bill 2749. So this would require that there be a written report that is submitted to the state with information about questions that have been asked of women who have undergone an abortion. And this would not apply in cases of an emergency procedure, but would require the medical provider to ask a number of questions of the woman before the abortion, basically asking her to explain why she's getting an abortion. What are the factors or the things that were causing her to take that action?
Can you talk a little bit about what's the conversation on both sides of those issues?
Yeah. So again, I think the state's interest in this information, at least from the appearance of the bill, is that if they were able to collect that type of information from women who are considering or very close to having an abortion, could they take that information and use it to help women, other women in the future? If those are the kinds of issues that are causing the woman to make that decision, are there things that the state can do to help with those women and to address those problems before they make the decision about the abortion? On the opponents for those bills, again, as always, the discussion comes up about privacy and are there privacy concerns or is that being too intrusive into a woman's personal decisions about an abortion by asking her to explain why she's choosing to have an abortion.
All right. So as we wrap up, and Carrie, do you want to tell us anything else going on with the legislature that we should watch?
Well, I think it's interesting, Teresa. It's not legislation that's in front of the legislature, but it's something that it's going on in the background that absolutely has a big influence on policy, and no policymakers are watching closely. Is the reprocurement of the CanCare program, so the managed care contracts for the Medicaid and Children's Health Insurance program that is underway now. That's something that is done in a confidential way, so that's not being done out in public in front of the legislature, for example. But certainly for both the budget and how the program operates, those contracts will have a big influence on public policy moving forward as well. So we're watching that closely and anticipate that the contracts will be signed per the state's published timeline while the legislature still is in session, maybe while they're out on first adjournment, but before they have finally adjourned. So it'd be interesting to see if any outcomes of that have any influence in discussions much later in the legislative session.
All right, sounds good. And we look forward to the next Health at the Capitol so we can see what results from all this activity and the discussion that's happening. But it's exciting stuff. And of course, we're watching and we're happy to inform you. If you'd like to receive Health at the Capitol directly to your email inbox, just sign up, register on our website at khi.org. Thanks for joining us.